Xylitol's role in remineralization. Key points essential for understanding caries. Caries is a bacterial infection. In fact, it's the most prevalent bacterial infection in the United States. And before cavitation, caries is a reversible multifactorial process. So you can stop decay and you can reverse it if you catch it early. In our office, patients receive treatment using the medical model consisting of the 4 steps: bacterial control, reduction of risk levels for at-risk patients, reversal of active sites by remineralization, and follow-up maintenance. Xylitol gum enhanced remineralization, reduced plaque, and improved gingival health. We still feel at this time that xylitol is the cornerstone of these procedures because of the effect that it has on the strep mutans and its calcium carrying ability. Of course, there are other things on the horizon. We will attempt to keep you updated if you are in our database or through our website. The following slides, we're going to talk about a product that we've been testing in our office for actually remineralizing and changing white spot lesions, fluorosis, or other demineralizations that are caused for whatever reason. You notice on the facial surfaces of tooth numbers 8 and 9, this is a demineralized, decalcified white spot lesion. We're going to treat this with a patent-pending product, and you'll be able to see the results. This slide shows the lesion after microabrasion that we use with a 12-fluted flame burr. Just lightly go over the surface of the tooth to remove the fluoride layer. If a fluoride layer is on the surface of the tooth, the minerals will not flow into the tooth. So what we're using, the solution that we're using is a xylitol solution with other minerals. Once we microabrade, we go ahead and etch with phosphorus etch, 30%. You only need to leave it on there about 10 or 15 seconds, so it's a normal etch procedure. And this is the same day after treatment, applying the patent pending gel. You'll see the effect that the lesion is almost mineralized that same day. On this slide, you'll see that we've got, could be fluorosis on the 4 anterior teeth, numbers 7 through 10. We're going to go ahead and treat those in the same manner that we did previously with the microabrasion and etch. This is the same day after doing those procedures. You can see that the white spots have been removed. This is non-invasive. We're not removing a lot of tooth structure. We're not having to numb the child or the patient. We can just flow the minerals into the tooth. Next slide. This is 5 months later. Now, the patient has been instructed to go home to not use a fluoride toothpaste, because again, if they use a fluoride toothpaste, it's going to seal those tubules, enamel tubules, so the minerals won't flow into the tooth. Now, this is significant because it is 5 months later. You can see that tooth gel that we sent them home with has locked in and eliminated those white spot lesions. This one kind of tugs at my heartstrings a little bit. This is a little 8-year-old girl that I ask, is there anything about your teeth that you don't like? And she looked at me, and I obviously knew that she wasn't going to like something. And she started to cry, and she said, yes, I don't like my front teeth. I wish they were gone because the kids call me chocolate tooth. And I looked at her and I said, how would you feel if I could fix those for you really easily and make them look pretty? And she said, I would like that a lot. And so she scheduled an appointment, and here's the result, same day treatment. Again, when I showed her the result, she looked in the mirror, and again, I got tears. These times were tears of joy, and I got a huge hug, which is the most satisfying thing that you'll ever get in dentistry, is a hug from your 8-year-old patients. Again, so let's go from here to here, non-invasively, same-day treatment. We hope to have this product available to the dental industry within the next year. Xylitol's role in treatment of levels 1 through 4. Xylitol administration and dosage guidelines. This is kind of a review. The administration of xylitol for dental benefits can occur in many ways. It can be administered in a mouth rinse, toothpaste, chewing gum, mint, syrups, or other forms. Those products that are sweetened with 100% xylitol are deemed to be most effective. Remember, it's the frequency, not the amount, that is effective. Dosage levels can vary depending on what the clinician assesses the need to be. Again, higher risk, more times per day; lower risk, fewer times per day. Examples of a protocol: levels 3 and 4, 8 to 12 grams each day with a frequency of 5 to 7. Level 2, 6 to 8 grams each day with a frequency of 5 times a day. And level 1, 3 to 6 grams each day with a frequency minimum of 3 times a day. Now, in the xylitol chewing gums, Those come in 0.72 grams per piece, so it gives you some idea. If it's a level 1, you're looking at maybe 3 to 5 pieces a day. Level 2 is a little bit higher. But also you can supplement. Brushing your teeth is also an application, so it doesn't all have to be with gums. It can be gums, mints, mouthwashes. So with the products that are available from some of the suppliers today, you have a lot more opportunities to provide your patients easy access to the effectiveness of xylitol. The xylitol's role in maintenance. Regular xylitol use should be encouraged as routine healthy habit, a continuing part of a normal hygiene regimen. And the best use of xylitol is an addition to the other hygiene recommendations. And remember that xylitol just needs to be used on a consistent basis for a period of 18 to 24 months, depending on the risk levels. Xylitol should be used immediately after every meal and snack, and is also encouraged for use between meals. It is recommended that gum be chewed for at least 3 to 5 minutes, after which time the xylitol content is practically nil. That's why it works so effectively with children, because we don't asking them for 10, 15, 20 minutes or whatever. The gum is, sometimes the flavor is chewed out in 5 or 6 minutes, but you have got the xylitol effect at that time. High peak concentration of xylitol may be more important than the amount. We still feel that the frequency needs to be in there at the same time. Chewing gum is considered an ideal delivery system for xylitol. It's the leading application. Chewing gums which are exclusively xylitol sweetened are the most effective for remineralization and caries prevention. In recent trials, the pellet-type gum with a nearly pure xylitol coating produced the best results, perhaps because high xylitol concentrations are delivered immediately.